Welcome to Motivate Therapy's presentation on post-COVID-19 syndrome effects on your core health. So I am Denise Nichols, owner of Motivate Therapy. I am also author of Your Self-Care Matrix and a board certified pelvic floor therapist and board certified in biofeedback for pelvic floor muscle dysfunction. So first and foremost, we are occupational therapists and physical therapists that focus on a whole body health approach. And our motto is that you cannot change anything that you're not aware of. And education and motivation are therefore the key to creating lifelong change. So we really encourage you to embrace change, regardless what life throws at you. And whenever we're talking about post syndromes, so post-COVID, post-Lyme, post-polio, the term syndrome has to do really with, it's the term they kind of throw on a group of symptoms that have a common denominator, such as COVID, that they really can't explain why it's lingering. And the way I came up with the term motivate, the name of my business, was I Googled words that mean hope. And motivate came out of that. And whenever you have something that lingers, longer than, I think either longer than a week or so, right? You have something, you say, okay, be careful. We're all living in fear of catching COVID. So then you catch it and you have the acute symptoms. First of all, you test positive because you have something that led you to get tested, right? So fever, they were saying over 100.4. The big one is anosmia, which is loss of smell, which goes along with loss of taste. You might have chest pain, shortness of breath, difficulty breathing. Right, the list goes on and on. I'm sure there's things that maybe that people that aren't as common, such as GI dysfunction, right? So upset stomach, diarrhea, constipation, things like that. Respiratory issues, and it's the respiratory issues that get us to the hospital, the respiratory distress, that why this disease is so deadly. So when you go through the acute phase and you test positive, you go through it, you no longer test positive, you think you're out of the woodwork, and you want to go back to your life, the life that you designed and built and we're living in pre whatever you got, right? So pre-COVID. But now you're no longer testing positive, but your symptoms are still there. You're still having things like chest pain, shortness of breath, heart palpitations, joint pain, difficulty breathing, difficulty sleeping. All of that can lead to poor concentration, poor memory, and then GI issues, upset stomach, bloating, gasiness, diarrhea, constipation. And so now you are no longer testing positive, you no longer have COVID, yet you still don't feel like yourself. And stepping back into your life is really not as easy as you'd hoped. So 4 weeks plus. So anything that has been lingering more than 3 months is considered chronic. So now you have a chronic illness that you really thought you just were gonna move through this like any other thing. So post-COVID syndrome is also being called COVID long haulers. That's a good one. And there's actually a COVID recovery clinic. And so I wanted to read this quote to you. We're seeing continued evidence that a fair number of people who have had COVID-19 continue to feel the effects of this illness for weeks to months after recovering from the worst of their symptoms or complications, says Dr. Sandeep Lahoti, gastroenterologist at Houston Methodist. So he is leading the COVID-19 recovery clinic. We still don't understand how long these symptoms can truly persist, but we do know that many of these people would benefit from specialized care in some cases and regular follow-up. So fatigue, right? We mentioned fatigue, and any post-syndrome fatigue is a common factor. And it sounds like something we just say, oh yeah, I'm fatigued, but that is where the loss of hope can happen. You have a job, you have kids, you have a life, you exercise, you have a routine that kept you healthy, and then you get COVID, and then you move through it, and then you're still not feeling healthy. So now you have a hard time moving through your life, the life that you built pre-COVID or anything. When you have, pain's another one, right? A herniated disc, you start having pain, and then it just persists. And now you're having to learn to live with these symptoms. So that is where occupational therapy and physical therapy come in. Learning to live with the symptoms, right, can get us into trouble. That's how our body continually will learn how to live in a protective state. So we're not exactly sure how these symptoms can persist, but we do know that they can last at least 6 months or longer in some people. And the manifestations of these symptoms are interesting and somewhat unique. So an MRI has shown myocarditis in some of these people, indicating that the heart muscle can remain inflamed for several months out, even if heart-related symptoms weren't prevalent during their illness. So as for the cause and long-term consequences of these lingering symptoms, that's still unclear. You know, we're still pretty new at this. The hypothesis range as to why, from hidden areas of infection to a prolonged inflammatory response. So those who seem to be at most at risk of developing post-COVID are adults over the age of 50, people who experience a more severe case, and individuals with underlying issues, especially respiratory and cardiac issues. So cardiopulmonary, hypertension, diabetes, and obesity. But they are saying that people are getting post-COVID, even if they weren't hospitalized, even in non-severe cases, people who just, were able to move through it in a week. So those COVID long haulers are not necessarily ones that had to get intubated and, got to near death. So that is something to understand. And in my book, Your Self-Care Matrix, I talk about understanding your body, right? So learning to hear and learning to listen. So hearing what your body is saying, so what your symptoms are, what your normal was before COVID, and then as your symptoms decrease or decline, what's still lingering, and then to understand the symptoms that were affected. So COVID mainly affects our respiratory system, right, which is our lungs, but our cardiopulmonary system, which is our heart and lungs. So heart and lungs are completely connected, and truly everything is connected. So your lymphatic system is part of this too. So the body will protect itself, I say, by bubble wrapping, right? So the lymphatic system will bubble wrap, will inflame around the area in order to help it heal, right? It's a good thing. We often think of inflammation as a bad thing, but inflammation is a good thing. It's how the body heals. Think of a cut, right? You want your body to heal, to inflame, and then to for the bad cells to die, good cells to be made. But while you're healing, while the healing process is happening, the muscles, the musculoskeletal system, and the neuromuscular system, right? So the nerves and the muscles will also go into protective mode. So, and that is where a lot of the complications can arise. But that is where OTs and PTs come in. I am not an expert in COVID, but I am an expert in the neuromuscular system. That is what OTs and PTs are experts in, is the muscles and how the muscles and the nerves interact in regards to function, in regards to how you have to move and function throughout your day. Let's first talk about those who are hospitalized. Even if you weren't hospitalized, you were down, right? So you're down for a week or more. Muscles atrophy in 3 days. It can take muscles 3 days to atrophy, which is, I think, amazing. So if we're talking about the respiratory system and COVID affecting the respiratory system, the diaphragm is a muscle. And so pelvic floor therapy is, or pelvic floor therapists are experts in understanding the neuromuscular interactions of the deep intrinsic core. So you can go to my Motivate Therapy's YouTube channel to learn or to watch about what is a pelvic floor. I did a video about that. Also on our website, motivatetherapy.com, what is a pelvic floor? 20-minute webinar, free webinar, where I talked more about the pelvic floor. So this is your pelvic floor. So tailbone, and then this slings to the pubic bone. So it's a sling of muscle that sits at the base of your pelvis. So essentially, you are sitting on your sling right now, right? You're sitting on that right now. And so what's cool is to think, right? So here's the hammock of your pelvic floor. You flip it over and it looks just like your diaphragm, what sits up underneath your rib cage. I'm gonna, hold on one second. So I dropped my container. We'll talk about that in a second. So diaphragm. Diaphragm muscle is a dome-shaped muscle that sits underneath your rib cage. I can back myself up a bit. There we go. Okay, so dome-shaped muscle that sits underneath your rib cage. So you can put your hands on your rib cage here, and when you breathe, you should feel the diaphragm flattens, so it pushes down and out, so the rib cage moves. So as you inhale, the rib cage flattens and moves the guts down, and then the floor has to accommodate that by lengthening. So everything moves down as you inhale, and then as you exhale, it pulls back up. So naturally, then what's supposed to happen when you cough, everything's supposed to draw up. So continence, right? So keeping urine and stool in is reliant on the diaphragm. So it's a huge part of your pelvic floor function, therefore your bowel and bladder and sexual function. So really important to understand. So we're hospitalized or we're down, we're not doing as much. We have a virus that attacked our respiratory and cardiopulmonary system. And so now the diaphragm can atrophy. Actually, it can atrophy, and that's what we're finding. And so there's been research, and we're going to find more and more research, but there has been research showing specifically COVID-19 effects on the pelvic floor. So generalized muscle weakness, not even just your pelvic floor, but just that muscles atrophying at 3 days. So you're not moving and being as active. You know that, right? When you've stopped exercising and stopped doing anything, going back to it is like the hardest thing ever. That is why. But getting back into it, having hope, that's where, having hope that you can get back to it. You might not be able to get back right to what you were able to do. And that's the thing is I think we lose hope when we're not realistic. And being someone that has a post syndrome, I believe that, I was diagnosed with neurological Lyme almost 6 years ago, and I'm still dealing with the after effects. So I basically consider it post Lyme syndrome. So the life I created prior to it, I'm not necessarily able to do everything that I was able to do. So I just have to keep adapting. So that's what I want you to understand first and foremost, is that there is always hope, that whether you're dealing with post-COVID or any kind of a chronic illness or chronic pain, there is always hope. Yes, your ability to do things have changed. Why? Let's understand the why. So generalized muscle weakness is certainly a thing. And then cognitive decline can happen as well. For those who are hospitalized, let's talk about PICC lines. So you can get infections from PICC lines. So they will put a line in your body in order to get antibiotics or whatever is needed to stop the virus in order to help your body. Maybe your lymphatic system, your immune system is not doing what it needs some help. So that is ultimately why we get put in the hospital and why we get put on medication, right? Is to help the body's immune system be supported so that your body can sustain life. So you can get infections from that. And also sometimes if you have to get a catheter because you're not as mobile. So for those who have to get intubated and those kinds of things, you can get catheters. So any of those types of devices that have to get put in your body, you can get chance of infection. And also research is showing that just extended hospital stays can affect cognitive function as well. People who have experienced ICU can get significantly anxiety from super sensitivity to sound and light from being in the ICU. Anybody who's ever been in the ICU or CCU could probably relate to that. PTSD type of symptoms, because it really is a trauma, being in the hospital, fighting for your life, just being diagnosed with something. I think just being diagnosed positive with COVID after everything that we've been hearing and the amount of fear that is behind it creates anxiety. We're living in such a state of anxiety. And you could also look on my Facebook page for another talk that I did about anxiety in your pelvic floor. So another thing that we're going to be talking about this month, along with post-COVID syndrome, is, well, it goes hand in hand, is overactive bladder, because anxiety, post-traumatic stress, and atrophy and dysfunction of the diaphragm affects, most significantly seems to affect urinary urgency and frequency. So feeling like you're living in the bathroom. Because anxiety and not breathing as well, right? So not taking nice, slow, deep breaths. I say, if I'm about to stab you with a knife, you're not gonna go, right? You're gonna lock it up, you're gonna protect your gut, and you're, right? You're gonna chest breathe. This kind of thing, this will happen. And if you have anything that has created neuromuscular tension in the chest and diaphragm area, like heart palpitations, chest pain, joint pain, that can create a tensioning in the upper core. So here's my little guy. If we talk about the core, so think about from your throat to your pelvis, it's like a can of Coke. And all of your organs are in here, and the majority of your organs are all sitting underneath your diaphragm, right? So your liver and your stomach, and then you have your small intestines, your large intestines, and then your bowel and bladder all sitting in your pelvis. And so coughing, right? So coughing, you can see that well, right? The pressure has to go somewhere. And if there's, what's supposed to happen is the lower belly muscle. So we talked about your deep intrinsic core. Pelvic floor is one of those muscles. The diaphragm is the muscle above. So floor, the diaphragm is what regulates the pressure. And really what the ceiling is your throat and glottal muscles. Diaphragm regulates the pressure. And then you've got the muscle in the front which is your low belly muscle, your transverse abdominis. So the muscle they cut for C-sections. We know that's, you know, the menopause pooch, for men, you know, the beer gut, the area that tends to really be affected with aging, weight gain and loss, weight gain mostly, right? So this muscle should contract when you cough, it should go in, and then the pressure should go up, right? So try that, put your hand on your low belly. And when you cough, you should feel your low belly go in. If you feel it go out, then let's look at what is happening to that pressure, right? Right? Then you can have pressure down. So if you have a muscle above the diaphragm or the chest that is over tight, atrophied, weak, it can affect the whole core pressure system. And so now pressure is going down, and that may cause urinary leakage, right? So urinary urgency is, I feel like I really have to go to the bathroom, get out of my way, I'm gonna pee my pants. Urge incontinence is you can't make it to the bathroom. You end up leaking before you make it there. So what we're seeing with overactive bladder and post-COVID syndrome types of things is urgency frequency. So based on how much water you drink, which they are recommending 60 to 80 ounces of water, I find that 40 to 60, I think is good in most people, depending on your level of activity, which you know has been curbed a little bit in some people. So it should be enough to where your pee is a light straw-colored yellow. So every 2 to 4 hours is about normal. So if you are peeing more on the every hour, every 30 minutes, feeling like you're living in the bathroom, feeling like your quality of life is being affected because your life is revolving around that bathroom, then that is not normal. Urinary incontinence and urgency frequency, curbing your life to deal with your bladder controlling your life, your bowel controlling your life, or any post-syndrome controlling your life, again, is not normal. So it's listening to your body, knowing what your normal is, and then communicating with your team. So that, right, we want to watch that pressure. So anxiety can create more mid-core tension, right? Anxiety, fear can create that, the tension around the abdomen, and that pressure can create a constant pressure down on the floor, and that can either tell the floor to be tight all the time and now it's weak, and that can move organs down. It can put more pressure down on the bladder, which can affect its ability to contract and therefore empty. And so now we're having maybe difficulty emptying your bladder, which will also make you feel like you have to run to the bathroom all the time. You could pee and then feel like 20 minutes later, you still have to go. So this can happen in men and women. And I'll talk more in relationship to men, BPH, which is benign prostate hypertrophy. Whereas there's an enlargement of the prostate, and that puts some pressure around the urethra and makes you feel like you have to pee, makes you feel like you're not emptying. And so what they're finding with post-COVID is, and what I have always said, when you go into something, so if you go into surgery with a hypertonic and overactive, whatever, neck, and then you go have shoulder surgery and they tighten things up even more, what you go into surgery with can come out worse after surgery. That's why having rehab prior to surgery is so important. It can really affect your outcomes. So the same can be said for your pelvic floor. So what you went into COVID with, so diabetes, obesity, hypertension, if you already had lymphedema, some kind of immune system, autoimmune issues, that could very much affect how your body heals and the timeline of how your body heals. And that does not mean that your body will not be able to heal. It just might not happen in the same timeline as your neighbor or your sister or your husband healed too. So being really careful not to compare I think is really important because that is where loss of hope can happen too. Let's see. So muscle weakness, we talked about, so urinary tract infections. So back to if you were cathetered, the catheter basically can make the pelvic floor and the bladder lazy. They don't have to do anything. The cath is just allowing the urine to come out. And there's lots of connections with cognition and cognitive difficulties and PICC lines and UTIs. So I have a really great talk coming up this month with an integrative medicine doctor and natural approaches, natural integrative approaches for UTIs, BPH, and OAB, overactive bladder. So make sure that you tune into that. So really what they're finding in the research paper that I was talking about, two PTs did on pelvic floor considerations for COVID-19, is that it's a team approach. And I talk about that in your self-care matrix as well, is that you really need a good team. So pelvic floor therapists should really be considered if you're having any kind of diaphragm types of issues, because it is one of the four of your deep core, deep intrinsic core muscles. And so in the video that I posted today, it shows that if you have, a job that requires 4 workers, we have your pelvic floor, your transverse abdominis, your low belly muscle, your multifidus, your low back muscle, and your diaphragm, right? To control and stabilize and support and sphincter, right? You have the job of 4, right? That's what it takes to do it effectively. And then one of them goes to the hospital. So the diaphragm's in the hospital. So now you have these three workers, and they're going to do it. They're just going to work harder. They might not sleep as much. They're going to do more. And then you're going to burn out one of them. Maybe your pelvic floor now burns out. So now you've got low belly and low back doing all the work, right? And so now low back, guess what multifidus connects to? Multifidus connects to your SI joints, right? Here's sciatic nerve and the artery that come out of your lumbar. So SI joint. So now you might start having low back pain or SI joint pain. So dealing with shadows, sorry. So learning to live with it means just your body learning to live with, okay, so now I'm gonna learn how to not no pelvic floor and then no diaphragm. It's not gonna get better. Yes, your body's gonna learn to live with it because it's amazing. But there are ways to deal with it. So the team approach, really important. So we wanna look at things like cardiology, pulmonology, so your heart and lung doctors, but also gastroenterology, talk to your local gut doctor, hematology, nephrology, neurology, so blood, kidney, brain. So we're really finding that this is affecting your nervous system. So physiatry and physical medicine, so your PT, your OT, and then your primary doctor. So really staying in contact with your primary care physician to let them know what's going on and how you're doing. So it's a new and unique phenomenon. So nobody knows your body better than you do. So you have to communicate, super important, and then find your circle of trust. Who is around to support you? Who do you feel that is hearing you? And who do you feel is not? So you just keep trying to find a team that you feel is supporting you. So muscle weakness, deconditioning, that is classic PTOT stuff. So getting to therapy, talking to your doctor about going to therapy to just get a physical routine back is really important. And then regarding the diaphragm, breathing exercises are really important. If you did not feel your rib cage move when I asked you to take a breath in, most people don't. They maybe feel their belly go forward, but they don't feel their rib cage move out. So that whole area, your lats, your serratus, your obliques, and then your rectus. Again, anybody who's had children, those muscles can just have been tight back from then and have learned to have a different movement pattern 20 years ago. And then now you go and you get a virus that affects that muscle, atrophies that muscle, gives the muscles around it reason to tension more. So I'm going to be posting all kinds of fun exercises and so breathing exercises, stretches, and core strengthening videos out. So make sure that you subscribe to our YouTube channel, stay on top of our website, our email. If you are not signed up for our newsletter, you can go onto our website, motivatetherapy.com, and sign up for it. Contact us for a free consult if you're interested in learning more about how to find hope, get out of the learning how to live around, move around the syndrome, the symptoms, whatever core group of symptoms you're dealing with. You can create positive change. Embrace change. Embrace what your body is giving you right now before the habits become really difficult to break, but they can. You want to look at the habits that are no longer supporting you. Your body is amazing. It created the habits to support you in that moment while you were dealing with COVID. Now you're out of danger, but that doesn't mean that those patterns aren't going to change, right? Especially the mind-body connection. There is still fear and anxiety that is going along with maybe having had it and moved through it and everything that you had to do or weren't able to do when you were sick. And now you're feeling this tension or this pain. And again, especially when you're feeling this kind of stuff, you're worried that you're having a heart attack or a stroke. So diaphragmatic breathing and opening up the chest and checking in, being mindful and present, that will allow your bowel and your bladder and your sexual function to come back, for your quality of life to come back, being present, not trying to control everything. Because I think that's what getting sick does, is it's a reality check, right? It's, whoa, I'm not in control. I thought I was, and I'm not. And now you get hit with something, it completely changes your life. And then you have two choices, to look at it as an opportunity to learn and grow, or to get stuck. And we all get stuck. And I'm not saying that I don't get stuck from one day to another, but we have to rely on each other, rely on our team of support, and know that help is out there, and that you don't have to accept what's going on right now. There are absolutely ways to change. So we can also do manual muscle release techniques to the diaphragm, rib mobilization techniques, biofeedback. I will be showing that more, but what it does is it measures the electrical activity of the muscle. So I put little electrodes here and then on the abdomen, and we talk about, it's not so much about the strength of the Kegel as much as it is about how well you coordinate. Remember, we talked about inhale, the floor goes down, exhale, you should be able to contract. So we can watch if the upper abdomen muscles overpower the floor. We can see that on biofeedback, which is really cool. And then that gives you such an amazing awareness of what's going on in the body. Most people, when I say Kegel, they give 100%, they use everything they got. And we're talking about a small group of muscles. So when you're on biofeedback, I can say, give me 25%. So try that. So just 25%, try to squeeze around the vagina or the rectum like you're gonna hold in a fart, and then let it go. Just 25%, let it go. Now give me 100%, let it go. Give me 25%, let it go, right? You hopefully still feel something, but the 25% is what's gonna retrain this muscle. 100% is this gonna keep retraining, or is this gonna keep the strong muscle strong, weak muscles weak? It's the same pattern that you've been living with that is not working for you anymore because your body is telling you something's wrong because you have symptoms. So autonomic nervous system quieting, right? So the sympathetic nervous system, fight or flight, that is what your body is in when it is trying to heal. And when it takes longer than usual, whatever that might mean in your mind, the sympathetic nervous system will be up. So chest breathing and muscle tension and not sleeping well. So sleeping is your time to get the parasympathetic system rest and digest. And that will affect the muscle tension anywhere, right? We know that our shoulders and our neck really can hold stress, but your floor, your pelvic floor, your core holds stress. Your core holds stress. So your floor will elevate. And then that isn't necessarily as functional. And so that's especially where overactive bladder can happen. I feel like I have to pee. I'm like this is my baseline. This is where I live. I go, I sit, I relax. I start to pee. The urine comes out through the urethra, but then my pelvic floor is used to this as my baseline. So I might now kink off the urethra, stop the flow of urine before I'm done. And so now my bladder is half full. I go, I move, and then 20 minutes later, I feel like I have to pee again. And then this cycle continues. But what if I breathe and relax and learn how to relax from above, give my pelvic floor the chance to be here? Now my bladder can fill, it can come up, I go, my bladder or my pelvic floor knows that this is at rest, and halfway up is all I need to keep the urethra kinked. So autonomic nervous system quieting, especially for those who have any kind of PTSD or anxiety from hospitalization, being in a dark, quiet room, learning what it feels like to be safe and present and in the moment. That is so important. So what goes along with really anxiety in your pelvic floor, overactive bladder, urinary urgency, frequency, incomplete emptying, and then constipation in the bowel side of the world. So that tension, again, it's going to be hard to get the poop out if you're not really able to relax those muscles. So we talk about that with biofeedback, with diaphragmatic breathing, and then stretching and opening and elongating the core, and then strengthening and stabilizing in order to get the muscles learning how to function and work again. But at your level, we build it at your level. And so no matter where you are in the world, looking into a pelvic floor therapist that can help address all of those. So your mental, emotional, social, spiritual, physical, intellectual, we should look at you as the whole person, because all of those things affect your physical being, right? And your quality of life. So strengthening your accessory muscles, your hips and your abs. Okay, so watch for the resources that are coming, especially the talk with that integrative medicine physician, and opportunities for classes on how to help improve BPH and benign prostate hypertrophy and overactive bladder. And be sure to check out my book, Your Self-Care Matrix, which talks more and more about really the whole 10-part system to help improve awareness and communication, so that you can get the most out of life. Embrace change, consistent, healthy awareness of the now. So now go, grow, and be empowered throughout your day. Thanks so much. Have a great day.